10 warning signs of low oxygen in your blood. Low oxygen levels in the blood can have profound implications for our overall well-being, impacting various bodily functions and potentially leading to serious health issues. Recognizing the signs of low blood oxygen levels is crucial for prompt intervention and appropriate medical care. In this comprehensive article, we delve into the 10 prominent warning signs that may indicate a deficiency of oxygen in the bloodstream. From the subtle to the more pronounced, these indicators can provide valuable insights into our body's oxygenation status and serve as a call to action for seeking medical attention when necessary. 1. Shortness of breath. Have you ever found yourself struggling to catch your breath, even during periods of rest? This unsettling sensation, known as dyspnea, can arise due to various factors. One significant cause is the presence of low oxygen levels in the blood. To understand the connection between oxygen levels and shortness of breath, it is essential to grasp how the body regulates and distributes oxygen. The respiratory system, primarily governed by the lungs, facilitates the exchange of oxygen and carbon dioxide. Oxygen is absorbed into the bloodstream, where it binds to hemoglobin and is transported to the body's tissues and organs. In instances of reduced blood oxygen levels, the body compensates by increasing breathing rate and depth. This mechanism aims to enhance oxygen intake and delivery but may prove insufficient if oxygen levels continue to decline. The resultant sense of breathlessness is akin to a distress signal, prompting deeper and more frequent breaths to address the oxygen deficit. 2. Rapid breathing. A natural response to dwindling blood oxygen levels is an increase in breathing rate and depth, commonly referred to as hyperventilation. This reaction seeks to augment oxygen uptake and counteract the oxygen deficiency. While hyperventilation can be beneficial during physical exertion, it may exacerbate the situation when driven by low oxygen levels. Excessive hyperventilation can lead to excessive elimination of carbon dioxide, which in turn reduces oxygen delivery to the tissues. The intricate balance between oxygen and carbon dioxide must be preserved to ensure optimal oxygenation of the body. 3. Wheezing. Wheezing, characterized by a high-pitched whistling sound during respiration, is often associated with conditions like asthma and chronic obstructive pulmonary disease, COPD. However, low oxygen levels in the blood can also trigger wheezing. As the body attempts to compensate for diminished oxygen, the respiratory system may induce airway constriction, contributing to wheezing. Factors such as inflammation and the release of substances like histamine may further narrow the airways, intensifying wheezing in response to oxygen deprivation. 4. Confusion. Oxygen is essential for the brain's optimal functioning, and any disruption in its supply can lead to cognitive impairment. Confusion, a common symptom of low blood oxygen levels, underscores the brain's dependence on oxygen for its myriad functions. Conditions like pneumonia, acute respiratory distress syndrome, ARDS, and circulatory disorders can interfere with oxygen uptake, resulting in reduced cognitive capabilities. Detecting confusion early, especially in vulnerable populations, can facilitate timely intervention and improved outcomes. 5. Headache. A headache is often attributed to various causes, including changes in blood flow and inflammation. However, a notable factor contributing to headaches is a deficiency of oxygen in the bloodstream. The brain, sensitive to even minor fluctuations in oxygen levels, responds with discomfort and pain when faced with inadequate oxygenation. This phenomenon is particularly evident at high altitudes, where reduced oxygen availability can trigger headaches as part of altitude sickness. 6. Cyanosis. Cyanosis, characterized by bluish or purplish discoloration of the skin and lips, is a direct result of diminished oxygen levels in the blood. As the body reallocates oxygenated blood to vital organs like the brain and heart, non-essential areas, such as the skin, receive less oxygen. This redirection manifests as cyanosis, serving as a visible indicator of compromised oxygenation. Factors such as respiratory and circulatory issues, as well as exposure to cold temperatures or high altitudes, can contribute to cyanosis. 7. Chest pain. Chest pain, particularly angina, often arises from an inadequate supply of oxygen to the heart muscle. Angina occurs when coronary arteries, responsible for delivering blood to the heart, become narrowed or obstructed. During physical activity or stress, the heart's oxygen demand increases, and a lack of sufficient oxygen delivery can lead to chest pain characterized by tightness, pressure, or squeezing sensations. Identifying angina as a potential symptom of low oxygen levels is crucial for early intervention and heart health management. 8. Fatigue. Fatigue, marked by a sense of tiredness and weakness, is a common consequence of low oxygen levels in the bloodstream. Oxygen plays a vital role in energy production through cellular respiration, and its scarcity can impede the body's ability to generate energy efficiently. Psychological factors like stress, depression, and anxiety, along with lifestyle elements such as poor nutrition and dehydration, can exacerbate fatigue in the presence of low oxygen levels. Recognizing fatigue as a potential indicator of compromised oxygenation underscores the need for holistic health assessments. 9. Dizziness. Dizziness, often characterized by lightheadedness or a spinning sensation, can be a consequence of insufficient oxygen supply to the brain. The brain's heightened demand for oxygen is met with dizziness when oxygen levels in the blood fall below the required threshold. Dizziness may be triggered by low blood pressure, anemia, dehydration, or medications, emphasizing the importance of considering various factors in assessing its underlying cause. 10. Sweating. Sweating is a physiological response aimed at regulating body temperature. In cases of low blood oxygen levels, the body's attempt to enhance oxygen delivery may lead to increased blood flow and subsequent sweating. Hyperventilation, undertaken to augment oxygen intake, can further contribute to sweating as the body endeavors to cool itself down. Recognizing sweating as a possible sign of low oxygen levels highlights the interconnectedness of various bodily functions. As we navigate the complexities of our health, understanding the subtle and overt signs of low oxygen levels in the blood becomes paramount. Each symptom serves as a vital clue, offering insights into the body's oxygenation status and potential health risks. From shortness of breath to sweating, these indicators guide us towards timely medical intervention, ensuring that the body's oxygen needs are met and overall well-being is preserved. It is essential to prioritize regular health assessments and consult medical professionals when any of these warning signs manifest. By maintaining vigilance and seeking appropriate care, we can safeguard our health and embrace a life of vitality and wellness. I want to express my appreciation for watching my video today. Remember to give it a thumbs up, share it with anyone you think might be experiencing these symptoms, and subscribe to my channel for more medical content. As always, my best wishes go out to you for your overall health, success, and happiness. Stay well, and we look forward to connecting with you in our upcoming video.